Hi, my name is Kayla Decker, and I will be presenting hemostasis. What is hemostasis? The definition, it's a process in which the body is able to stop a bleed coming from an injured blood vessel. This is a multi-part process. It happens very fast in seconds. It could leave behind something like a bruise or hematoma, depending on the quantity of blood loss, like seen in the picture up top. And then this is essential for maintaining equilibrium. Problems may occur if the body is unable to maintain hemostasis. There are several stages of hemostasis. One, there's vasoconstriction. The blood vessel will tighten during a vascular spasm in the damaged area. The smooth muscle contracts, signaled by pain and chemical receptors. This, as a result, reduces blood flow to the area, therefore helping reduce blood loss. Then there's platelet plug formation. Platelets stick to exposed collagen fibers at the site of injury. This is promoted by the von Willebrand factor. Platelets then aggregate to release chemicals such as ADP and thromboxane A2, which recruits more platelets to the area. Then coagulation. The platelet plug is reinforced by two methods, the intrinsic and extrinsic pathway. The extrinsic pathway is initiated by the external trauma or the tissue injury that exposes the tissue factor number 3 to the blood. The intrinsic initiation comes from within the bloodstream by internal damage. Both pathways, however, activate the enzyme thrombin, which converts fibrinogen to fibrin, and fibrin is the one responsible for securing the red blood cells and the platelets together at the site of injury. Here we have a diagram that visualizes hemostasis. Number 1, again, you can see vessel constriction happening. The platelets are not yet in picture, but the red blood cells are escaping at the site of injury. And then number 2 on the top right, that's the platelet plug formation, also known as primary hemostasis. You can see the platelets coming together at the site of injury to form the start of a clot. Number 3, the coagulation begins. That's when the intrinsic and extrinsic pathway are activated, reinforcing the platelet plug. And as a result, number 4, the stable clot is formed. Now, if a blood of a person clots too much or too easily, this is called hypercoagulability. This can be life-threatening, leading to stroke, which is the occlusion of a blood vessel supplying the brain, a DVT, also known as deep vein thrombosis. This can happen anywhere in the body. A heart attack, one or more of the vessels that supplies the heart is blocked. Some interventions included here. A person can be treated with antiplatelets, anticoagulation, and fibrinolytic medications. This is such as Plavix, heparin, or TPA. And the opposite, if blood does not clot quickly or enough, this is hypocoagulability. This puts people at risk for high blood loss. And when a large amount of blood is lost in the body, this becomes life-threatening, leading to sepsis, which results in multi-organ dysfunction. Just to help prevent large blood loss, this can be even just from like falling off a bicycle, scraping your knee. A person could receive a blood product transfusion frequently as a preventative measure to hopefully increase their ability to coagulate, but this must be done often. So therefore, in the end, hemostasis is essential for maintaining equilibrium in the body.